Good morning, my name is Daniel Paul and I'm here today with the Chief Executive of Alzheimer's New Zealand, Catherine Hall. We're going to be talking about the Dementia Action Plan, which the dementia sector has partnered to produce and which it is now presented to the government, to Health Minister David Clark and Associate Health Minister Jenny Salisa. We're going to be talking to Catherine about a range of issues around the plan, why the need for the plan, why now, what does the plan actually address, what is wrong with the health system when it comes to the issue of dementia, and what are the plan's key priorities. So we're going to work through a series of these videos. I hope you enjoy watching them and I hope you learn a little bit more about dementia and about what the dementia sector is doing to support those with a diagnosis of dementia. So, Catherine, thank you for your time today. We look forward to talking to you in more detail about this and learning more about the plan. So tell us, if you could, what's the background to the plan? Who developed it and why the need for it?
Well look, Daniel, dementia is one of the most significant healthcare challenges for New Zealand but also globally. And this is something that we've known for a long time. The numbers are going up, the costs are going up, people with dementia are missing out on services, and the pressure on the health system is only growing. But even though we've known that for some time, nothing has happened. And so the window to do something about that is closing rapidly, particularly because, you know, as we all know, the baby boomers are now ageing, and so there's going to be a rapid increase in numbers. So New Zealand really has to do something now, and that's why we wrote the plan.
So the Dementia Action Plan, whose idea was it and what was involved in its preparation?
Well look, I was really concerned that nothing was happening. Government wasn't doing anything, and so I talked to some of my colleagues in the dementia sector, and a small group of us got together and developed a draft plan. That was last year, early last year. That plan was consulted on with the sector towards the end of last year and into the early 2020. And that was a very good process. We got feedback from over 300 individuals and organisations who provided a lot of really useful comment that strengthened the plan, but also very strongly said how important the plan was and how important it was that we got on and started to do something as a country.
And the plan actually includes input and feedback from people affected by dementia?
Absolutely. So on the small group that did the work on the plan, it was somebody who lives with dementia, who's got a diagnosis of dementia. Alzheimer's New Zealand's advisory group, which is made up of people living with dementia, provided a lot of input on the draft, as did many other people from around the country.
Thanks, Catherine. Appreciate your time. Please keep an eye out for the next in our series of videos about the Dementia Action Plan.